Hi everyone, I welcome you all for this Nursing Wisdom channel. Today we are going to see about sponge holding forceps. Sponge forceps, otherwise called as sponge holding forceps, it is used to hold onto sponges or swabs while doing medical procedures. Parts of sponge holding forceps: it has finger rings that enhance handling, ratchet, it is a locking mechanism, shank, box lock, and jaws. Next, features of sponge holding forceps. Sponge holding forceps are usually made in the shape of a scissor. The jaws of these forceps can either be serrated or they may be smooth. The handles are ratcheted as well as looped. Ratchet is a locking mechanism. It helps the surgeon to hold the gauze family and place it in the right position. Sponge holding forceps can either be curved or they may be straight depending on its specific purpose. Typically, sponge holding forceps are 7 to 9 inches, about 18 to 23 centimeters in length. Types of sponge forceps: Forster sponge forceps. Forster sponge forceps are another type of forceps that are smooth. So during any medical procedures, the tip of the forceps don't cause any irritation to the wound of the patient. There are different styles of tips, which are smooth tips, serrated tips. There are two types of Forster sponge forceps, that are curved Forster forceps, straight Forster forceps. Fletcher sponge forceps. Fletcher sponge forceps with serrated teardrop jaws that are presented in either a straight or curved style. Although these forceps are made for general surgical procedures, the most common field to utilize this instrument is gynecology. Ramley sponge forceps. Ramley sponge forceps contain straight jaws with loop tips used to hold sponges for situations such as when a patient's skin needs to be prepared prior to surgery. The jaws themselves are elongated and contain serrated tips to hold swabs or sponges and reduce the chance of slippage. Peanut sponge forceps. Peanut sponge forceps are the kind of sponge forceps. The best thing about these forceps is that they are reliable, remain dependable for medical personnel. Fletcher Van Doren sponge forceps. It is an extended version of Fletcher sponge forceps. There are different kind tips which are S-curved, serrated, narrow loops. Next, uses of sponge holding forceps. Sponge holding forceps normally used in surgical procedures to hold gauze squares that will absorb excess fluids and blood from the surgical site. Gynecology is the most common medical field that used sponge forceps. They are often used in surgical procedure for female sterilization, such as an intrauterine device being inserted. In such situation, it is generally recommended to use curved forceps. Sponge holding forceps used during an abortion to keep the cervix and uterus in place, as well as after surgery for cervical inspection and removal of tissue. A sponge holding forceps can also be used for non-surgical procedures. A doctor may use them during an examination to hold back the cervix or bladder. The sponge forceps can be used as a clamp to stop bleeding, as well as a divider to separate membranes that are stuck together. Sponge forceps can also assist with vaginal tears and cervical checks during a postpartum checkup. A medical process called a vaginal uterine artery ligation may also require sponge forceps. This measures it used to help lower the risk of hysterectomy following a birth. It also aids in preventing blood loss. Sponge forceps can also be used in applying onlay graft for inguinal hernia repair, as well as in removing polyps. Sponge forceps can also be useful in holding cotton balls during colposcopic procedures. They may be used to treat abrasions as tonsil wipes, grasping gauzes, sponges, and other sensitive materials is another of their many uses. Surgeon can use these forceps during lung surgeries such as bulloctomies. Their blunt tips enable surgeon to both hold and collapse the lungs as well as to gently move lung tissue in order to fully investigate the area. In such operation, they are considered standard thoracic instruments. Next advantage of sponge holding forceps. Sponge forceps allow minor surgical operation to be performed without excessive trauma or damage. Many doctors prefer to use these forceps because they help minimize damage during surgery. These forceps enable a physician to hold and move tissue very precisely and gently. They are also helpful in preventing trauma. Here I am concluding. I hope you got some idea about sponge holding forceps. Thanks for watching.